Welcome to the Med Spa Method. My name is Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist and the owner of Real Aesthetics and Wellness. This show is your guide to navigating the med spa world with confidence. I'm going to talk about the treatments, the trends, and how to find a provider that you can trust. Because when it comes to your health, your face, and your results, there is a right way to do it. Welcome back to the Med Spa Method. I'm Leslie Schweitzer, and today I'm going to talk about Radiesse. Radiesse is a dermal filler, but it's also a biostimulator, and it's incredibly versatile. So I want to talk about all the ways that I would use this product, or that I do use product, ways that I like to use it and don't like to use it, and why it's become such a favorite of mine. Radiesse is different from most of the other fillers on the market because of the way that it's made up. It is a CAHA, or it's written as capital C, small a, capital H, small a, and that stands for calcium hydroxylapatite. And that is a milky looking substance versus when we look at most other fillers, they're clear. They are made of HA, or hyaluronic acid, and they are more of a product that you place them and you get what you get when you place them. Radiesse, as a biostimulator, it has a little bit of gel property to it, so you get what you get, but you also get this incredible ability to stimulate more collagen on your own, which you get even more out of the product. So you don't just get what you see that day. The results keep getting better and better. It's going to stimulate new collagen formation in the forms of type 1 collagen and type 3 collagen, which is going to set it apart from some other biostimulators. So that type 1 collagen is kind of like scaffolding. It's a little bit firmer collagen, and type 3 collagen is a little bit more softer collagen, which is more kind of associated with like that youthful plumpness, and the scaffolding of type 1 is more of that like foundation that you need in your skin to be able to put other products on top of. There's often times when I'll say like, well, we need to build you a little bit of support before we do this or that other thing so that it doesn't sink. And most of the time it's when we're addressing under eyes, to be honest. Patients will say to me, I'd really like to address my under eye bags. And I'll say, well, you don't have any support in your cheeks. So if all I do today is address your under eye bags, what's going to happen is whatever I put under your eyes, oftentimes it's filler that they'd like to have. If I just put filler under your eyes and there's no support in your cheeks, that filler is going to fall down with nothing to sit on top of, and it will start to pull and look bad. So I don't ever do that. I don't ever do under eye filler unless they've done the proper pre-work, which is, proper cheek support first. And oftentimes if we just support the cheeks, if we just replace the volume loss in the midface, we don't have to go to under eye filler. We're oftentimes able to just completely avoid under eye filler altogether if we take the proper steps first. So I kind of went down a little rabbit trail on that part here, but there are other biostimulators on the market. Sculptra is one I'm asked about the most often, and Sculptra is a product that's made from PLLA, and it does biostimulate as well, but I don't reach for Sculptra. In fact, I don't even carry it now. The reason is because Sculptra, in my opinion, is very expensive, and I don't really like it for the face because of what it's meant to do. Now, if you remember when I said Radiesse has some dermal filler inside the product, I really can place it exactly where I want it to go, and I see the results of what I want it to do that day, and so does my patient. But Sculptra is placed a little bit more, I feel, less artistically, and it's placed just to stimulate volume. And it's said to be smart that it won't stimulate volume where you shouldn't have volume. But if you look back, when it was actually FDA approved, it was FDA approved in 2004 for a specific problem. And that specific problem was HIV associated facial lipoatrophy. And what that means is that when patients have HIV, the medicines that they're taking and the disease process makes their face waste away and they look very emaciated. And Sculptra was being used to just place diffusely across the entire face and give them back some of that plump, round appearance of a natural, healthy person. Now, when we do that on somebody who's not emaciated, what we can end up doing is just making their entire face a little bit more round. And that's really not what we're looking for with filler. We should be using filler, in my opinion, to sculpt the face, to replace, the cheekbone where bone is degrading, to replace the jawbone where the jawbone is starting to degrade, or where we're losing fat, we should just stimulate collagen in that area or replace with hyaluronic acid filler in that area. It is not something that you just whip all over the face, in my opinion, and just hope that we get the best natural response. So what I do like Sculptra for is places where we do want something like big, plump, and round, which would be like the people who are using it like in the booty. You can place Sculptra or Radiesse in the booty to help plump up your booty a little bit. And it's very expensive for that treatment, but I do think that it works well in that setting. But it's not enough of a high demand for me to carry the product in my spa. So I just carry Radiesse. I don't treat people who are looking so gaunt that I need to just put a whole bunch of Radiesse all over their face and just try to re-round them out. It's just not what's busy in my practice. But if that is what you're looking for, then I'm sure you can find someone nearby. Sculptra is very, very popular. And I'm asked about it, but that's how I explain it, is that I would much rather use something that I feel I can be a little bit more of an artist with. And so for me, that's Radiesse. My favorite places to place Radiesse just right out of the box. So what I mean by that right out of the box is I use it just like any other filler. I take it out of the box and I don't change it in any way. Radiesse is a really cool product that we can dilute, and we can use it diluted to achieve other goals. Like when I just mentioned, like rounding out the booty, you would actually dilute it for that. But I like to use it straight out of the box when I'm working on 3 specific treatment areas. And for me, that's cheeks. I love it undiluted in the cheeks because, like I said before, I can kind of build that scaffolding so that my patient has a little bit more support in their face. And I can also make them a little bit softer with that softer type 3 collagen as well. I also really like Radiesse in the jawline. So we don't talk, I feel like, as often about the jawline, but if you were to look at your side profile, maybe you don't realize it, but the reason that, you might look older is because you cannot see that angle of the mandible. So I'm talking about that back corner of your jaw. If you can't see where that is, oftentimes we'll say carved out or snatched. If you can't see that angle well, it tends to age you. So I like to place a little bit of Radiesse back there to kind of mimic the bone that should be there and re-carve out the jawline. So I very much like it in that area. It very much defines the jaw. I also like it before, like, uh, in front of and behind of that little jowl that happens as we age. So you might feel like oftentimes patients will come to me and say, like, what can we do about this jowl? And one of the easy things that we can do is we can actually just camouflage it. We can place a little bit of filler in front of and behind it and smooth that area out so that it's a smooth transition. We're not actually touching the jowl at all. We're just camouflaging it, and it looks very nice in the jawline that way. I also like to use it like in kind of in the same area, like right in the chin, right in the middle of the chin. Women like to have a little bit of a pointed chin, like not a witchy chin, but more of a pointed chin versus a squared off chin tends to be a little bit more masculine. So if you lose, facial volume in your chin and it's starting to square off, putting a little bit of filler there to round it out or make it have a little bit of a point to it, not a witchy point, but a little point, looks very feminine. And I really like the product straight out of the box just for that. I feel like I can get a lot done that way. And as I mentioned previously, probably my all-time favorite place to place Radiesse is in the cheeks. And I just feel like I can get so much done with the product in the cheeks by replacing some volume because it does have a little bit of dermal filler in it. And then I can also see those lasting results with building of the collagen. Now I'm going to start talking about diluting out the product and placing it in other areas. So oftentimes you'll hear people call this hyperdilute Radiesse. There are studies out there that talk about diluting out the product. So it's not like your injectors being a mad scientist. There is a method to this treatment. It is not some kooky backdoor spa thing to try to make the product go farther. It's actually just changing the way the product is used so that it suits the needs. And that's what I love about Radiesse is it's so incredibly versatile. So what we would do if we were diluting out the product is we would mix it with one of a few things. So it could be mixed in so many different ways. It could be mixed with just plain saline. And if you mix it with just plain saline, all you're doing is that gel quality is kind of going to go away and we're no longer going to get any plumping immediately. We're instead going to just be spreading out the little bit of biostimulator. And this can be diluted with saline like 1:1 or 1:2, or even 1:4 to spread out that biostimulator effect from the product. Next, what we could dilute it with, and this is what I would prefer most of the time, is I like to take a patient's PRP. So we're going to have to rabbit trail a little bit so I can explain what PRP is. But PRP is platelet-rich plasma. There's a couple different ways that we can use your own platelets and inject them back into either your face or whatever area that we're trying to build collagen in. And the way that it's going to work is by biostimulating, using your own biostimulator, your platelets. Platelets are healing by nature. That's what their job is. So if we take a concentrated amount of platelets and we put them in your cheek, for example, we're just telling your body, hey, there's an injury right here. Come fix it in a natural way. And I like that because it has a high degree of safety. It's already your product. So there's not any risk of an allergic reaction because it's yours and we're just putting it back in. So very low risk that way. And if it's done, clean and carefully, there's also very low risk of infection because the product couldn't have ever become compromised in any way. And there's a very low risk of other things going wrong with the filler, like your face can't, or your own product, your own PRP. There's no risk of your body like rejecting it or looking real uneven because it's stimulating this natural response. So I just feel like there's a higher degree of safety with PRP than most dermal fillers. And because of that, it should be highly valued in your treatment plan. So in addition to just drawing the blood, spinning it down, taking off that platelet-rich layer of plasma, there's other things that we can do with that plasma. We can heat it and cool it and mix it with the platelet poor plasma, and that's called easy gel, and turn it into its own gel product. It can be spun with or without an additive called ACD. And when we spin it without the additive, we're actually preserving the fibrin in there. So we would call that platelet rich fibrin. And that's a little bit harder to work with in my experience because it does activate very, very quickly. And so you need to cool it down so that you can work with it, or you need to inject it really quickly so that before it starts to clot up. And then there is a way to make a kind of a pseudo platelet rich fibrin, which is called a platelet rich fibrin matrix, when you purposely add in a little bit of calcium into your mix and make that fibrin matrix. So all this discussion about PRP, basically when I take out PRP and I like to mix it with my Radiesse, I like to use it just straight. I don't like to activate it and turn it into easy gel or platelet rich fibrin matrix. I like to just take it plain how it is because I want it to be real liquidy, to dilute the Radiesse to be quite thin for the purpose of injecting it in very thin little layers to stimulate collagen. So if you can imagine, what I'm proposing is we take out the blood out of the patient, we spin it down, we take out the platelet rich plasma layer, which is very thin and watery, and we dilute that into the Radiesse and make the Radiesse, which was a gel-like substance, also into something pretty thin and watery. And now we're going to use this thin and watery, very collagen stimulating product of Radiesse and your own PRP and inject it into areas which need improved skin elasticity or skin tightness. We'll also use it for, we'll say, skin integrity to improve that area of the skin. Now, in this way, it can be done and most popularly on the neck, which we would call that a Radiesse neck wash, where we would take the product and just, it's all diluted, and we would take it and we would just inject it all around the neck and massage it in a little bit. And when we're doing that, we're just putting it just a little bit beneath the skin. And it will initially, you might see little areas where it was injected, but it will soak in very nicely. And we'll have you go home and rub your neck twice a day. Nothing aggressive, but just when you apply your neck cream, you're going to rub it in just a little bit and keep stimulating the movement of that product around so that it settles nicely. And across the next 6 weeks, you're going to develop collagen stimulation in the neck and see improvement in skin laxity, so that turkey gobble tightens up a little bit. And it also helps with those tech neck lines, so we can inject it right into those tech neck lines to help with that area, and we can kind of diffusely, fan it all the way across those areas as well to help to tighten up that skin as well. When we're talking about Radiesse neck wash, there is a specific treatment plan out there that has been studied and approved, and it's called the GOLD protocol. That GOLD protocol takes the Radiesse, and when you're making your dilution mixture, it adds a couple of other things. It adds a little bit of Belotero, which is another hyaluronic acid product filler that's made by the same company, MERS. And the reason that we're doing that is just to help further smooth out the skin and give those immediate results that we're kind of taking away from diluting the Radiesse. We're putting that back in to produce immediate smoothing, pretty results. And it's also like in this setting, kind of like an injectable moisturizer because hyaluronic acid is, it holds onto water. So it can be very hydrating to the skin. So we're putting it into the mix in that way. And we're also going to add in there a little bit of neurotoxin. And the one that was studied with this was 50 units of Xeomin. And Xeomin is, again, the MERS brand of neurotoxin. And the reason we're doing that is because we're hoping to keep the product there a little bit longer. And so the Xeomin is doing that, is helping it stay there a little bit longer. And we're also going to boost the skin integrity that way as well by placing it there. We're not going to stop the movement of any muscles because we're not injecting the neurotoxin into the muscle. So it's a off-label kind of weird way to use Xeomin, but it is cool that it can all be combined that way. What's a little bit more popular for me versus that whole cocktail of Radiesse neck wash is, again, of gold protocol, I should say. What's more popular for me is that I would just take the Radiesse with some PRP, dilute that out, and do the neck wash that way. I also like to take the Radiesse, dilute it out with PRP again, and I like to use that for skin texture or skin laxity up in the cheeks. So when we talk about classic cheek filler, we're talking about where like the meat of the cheek is enhanced. So if your cheeks are a little bit flat, we're plumping that back up. In this fashion, we're actually looking at the whole cheek, across your whole face, really. And we're looking at that skin that is starting to sag and form a jowl there, or just little wrinkles across the entire cheek. And we're just very superficially, just right underneath the skin, going to place this diluted Radiesse across all of your cheek. And it's going to soak in there and stimulate that collagen for tightening up and firming up the skin itself, versus what's deep underneath it when we're placing filler for, to replace cheek volume. I hope that's all making sense. So this, one syringe of Radiesse mixed with some PRP could easily do both sides of the face and improve skin quality across the entire face. The results on here are going to be a little bit different than when we're using Radiesse straight out of the box to plump up the face. We're going to see immediately a little bit too much of a rounded experience. Now, when I talked about Sculptra, they also, when you inject Sculptra right away, you also have a little bit, you leave puffy and round. Radiesse is a little bit less so. It's not quite as swollen. You won't be quite as round. And I feel that the bruising is lesser as well. So we would place that kind of diffusely across both sides of the face. And then I would tell you the same thing as a Radiesse neck wash. Go ahead, go home. Both times that you wash your face, morning and night, I want you to rub your cheeks a little bit more than you normally would, just to fully integrate that product into your face, and just do that for a couple of days. I should mention with Sculptra, they have this 5-5-5 thing where you need to massage the area that it was placed for 5 minutes, 5 times a day for 5 days to really integrate the product. And I feel that Radiesse goes in a lot more with less trauma. And so I only have to instruct people to do this for 3 to 5 days, just integrate the product into your skin when you wash your face twice a day. So I say twice a day for 5 days and no 5 minutes. Just when you're doing your routine, just rub it a little bit and move on with your business. And I've had zero problems with that. A little gentler technique. Versus with Sculptra, patients will say it's uncomfortable to rub it for 5 minutes for that long. It's bruised. I don't want to be touching it this much, etc. So I do like this kind of home care routine with Radiesse more than the Sculptra home care routine. Diluting it in the same fashion, another popular area to place Radiesse would be that bunchy skin we get just above your knees. That area can be just kind of pesky. So we can fan it in the same way above the knees and really help tighten up and give your legs more of a youthful appearance. Now, to do the entire leg, like let's just say that your entire thigh was like real wrinkly and whatnot, it would require a bit more product. But you could use one syringe and do that little pouch above each knee and get beautiful results with one syringe of filler mixed with some PRP. It's also done in the abdomen, which is kind of popular for women who have had babies and their belly stretches out, and then your belly goes back, but the skin doesn't go back quite as well. We can use some dilute Radiesse with PRP in the exact same fashion. We're diluting it out, we're fanning it out around there, and then we're sending you home to massage it twice a day. It's a beautiful treatment in that area as well. And I briefly mentioned that it can be used to like plump up the booty or to help with those like dips that sometimes you get in the side of your butt. And it's just as you age, your booty's not quite as round anymore. So if we want to put it into those like dipped in areas, that requires quite a bit of product to restore that much volume. So we are going to dilute it a little bit, and then we're going to fan it in there to restore volume. And when I say quite a bit of products, I'm talking like 10 syringes of filler to just improve that dip and restore that much volume in such a large area. So it is a little bit expensive, and for that reason it's really not very popular, but it can be done. Now, people will ask me on that same note, could you stimulate volume or add volume to the breast tissue? And that is a no. The reason is because that CAHA, the calcium in the hydroxylapatite, will show up on imaging scans. So if you think like your mammogram, MRI, CT, it does show up in those areas. And as women, we go in to have breast cancer screenings, and we don't want to cause any false positives by placing a bunch of product there that would interfere with the scan. Or, I mean, what would even be worse would be a false negative where they can't see really what's going on because you got a whole bunch of product sitting there on top of your chest. So in that regard, Radiesse is really not proper for that placement. A little bit of platelet-rich plasma can be put there to help with the skin laxity that can happen above the breasts. Radiesse or PRP is appropriate to do that same fanning technique, like on the décolleté, far above the breast tissue, to help with, that line that you get, from sleeping on your side. And it's very beneficial in that area. But sometimes when that conversation comes to me, I will suggest it. Radiesse is a nice product here to stimulate collagen and smooth out the skin texture. But I also have something at my disposal, which is a CO2 laser, which I would prefer to use on that treatment area because the CO2 laser can also pull off sun damage, which most clients have sun damage on their décolleté because you're better at putting SPF on your face and neck, and then all of a sudden your décolleté goes by the wayside. So I often find that we can kind of check more boxes by doing that other treatment in this one setting of the décolleté than by doing dilute Radiesse in the décolleté. Radiesse can also be done on the hands, and I used to do it more frequently than I do now because, like I said, now I have the CO2 laser and I feel like I can get just as good of results and then again remove the sunspots at the same time with CO2 on the hands. But Radiesse can be diluted and placed on the hands as well. What I forgot to talk about is I like to use Radiesse straight out of the box for temples. The temples are sometimes neglected when you're thinking about filler, but if you have overdone cheeks or if you're just simply part of the aging process, is temples begin to look a little bit hollow. So if we place product in the temples to just smooth the transition from the forehead to your cheek is really all we're doing. We're not trying to make you round, but I do like a little bit of Radiesse in the temple to smooth that out. And it can be done straight out of the box or diluted in a 1-to-1 fashion, and that's going to depend on your injector's technique and preference, but it can be done either way. I personally like to use it straight out of the box, and I like it that way because I don't see almost any swelling or anything, and it's just immediate results, and it's actually not very painful to inject that area at all. So I find that it's a wonderful product in that area. And then lastly, I would just say that injecting Radiesse is incredibly versatile, as you've heard. It's wonderful for so many different treatment areas and problems, but there are a few people that I don't like to use Radiesse on, and that would be, I obviously would not want to put this on anybody who's pregnant or nursing. It's just not the best time to have dermal filler done, so I do have those patients wait a little bit until they're through that phase of their life. And I also don't like to use Radiesse on people who have autoimmune disease. Now, some of this is just a discussion with the patient themselves, but if they're somebody who's having frequent flares of their MS or lupus, I don't want to use anything that depends on their body to respond appropriately. And I know there are injectors who do, and there are patients of mine who I have done this to. And it's different based on, like I said, how many flares they've had, how well managed are they or mismanaged, matters. Because if they are having those frequent flares and their immune system is really just kind of out of whack, it's really not great to depend on their body to respond appropriately because they don't. So I don't like to use it in that setting. But if someone comes in to me and they say, you know what, I was diagnosed with lupus in 2014 and I was put on this medication for it and I have not had a flare since, then I might do it. I might just explain to them, here's the thing. You're on an immune modulator and that turns your immune system down because your body doesn't respond appropriately. So we can do this, and you just have to understand that your results may be a little bit lesser because your immune system is turned down. They might be perfect, but they might be a little bit lesser. But the risk that I would be avoiding on somebody who is not well controlled in their autoimmune disease is, what if your body reacts the wrong way? What if your body gets real upset with what I do? I don't want to do that to you. I don't want you to have massive swelling. I don't want you to have a horrible healing journey. And I certainly don't want you to have a lupus or MS flare or whatever and have to go to your doctor and get treatment. So this is just not the best product for you. Those patients, instead, I would just restore their cheek volume with a hyaluronic acid product that I feel is much more tolerated. And this is all my opinion. Obviously, it's my podcast. So I'm not giving out any medical advice. That's just what I would tell my patients in my chair is I'm not going to put you at risk in that way. So that's everything I have to say about Radiesse. And I think for that reason, it's clear that Radiesse would be, if I was told you can only carry one dermal filler in your practice, what would it be? It would have to be Radiesse because I can get all of these things done. I don't love it as a lip filler, so that would be sad to see that go. But I would still say Radiesse is the filler that I'm going to choose if I can only carry one. And thankfully, that's not the choice. I get a whole bunch of products that I can inject, and I'd love to do a separate episode talking about those other products and ways that we use those other products. So that's for another day. Thanks so much for joining me. I'll see you next time.